Hi everybody, this is Dr. Thomas. This is a really quick video to introduce you to what we're going to be covering in the first week of preparation for professional practice, fondly called Triple P. I know that some of you are nervous, and that's why I'm recording this video, to help you better prepare and feel a little bit confident about what you're walking into. Just know that you are very well prepared and you're ready for this. So Dr. Gantman and I are the instructors for this course. I'm going to be with you the first week, and Dr. Gantman is going to be with you the second week. So the first week we're covering older adult and adult. Second week is child and adolescence. I would suggest that before you continue listening to this video that you print out the syllabus so that you can take notes as we go along. So for the first 9 pages, I'm going to let you read all of that on your own, some fun late night reading. You can see that all of our textbooks are going to be used in this course. You have a grade for the first week and then a total score for the second week. And we are going to skim forward all the way to page 10. Okay, on day 1, we are going to be meeting together at 9 a.m. in room 618. Please bring with you your textbooks, everything that relates to the adult and older adult population. In the morning, we are going to review the evaluation process. So we will go through, review things like our manual muscle testing, range of motion testing, sensory testing, cognition, all of that stuff. So be prepared for that. Myself and Dr. Eng will be with you that morning. In the afternoon, you will be doing a fun activity that will help you review intervention planning and intervention. Also that will be it'll be really helpful if you have your books during that time as well. But that will be primarily independent study. Dr. Eng and I will be checking in with you throughout that afternoon just to see if you have any additional questions. So day 1 is lots of review to help you prepare for the rest of the week. On day 2, on Tuesday morning at 9 o'clock, we'll meet with you. I'll be meeting with you in 618. And that's when I will be giving you your cases. You'll also want to have your books, textbooks, your evaluation kits, your gait belts, anything else that you might need to evaluate your client, because you're going to be evaluating your client in the afternoon. When I hand you your case at 9 o'clock, it will have brief information. It'll have your client's diagnosis, the setting, maybe a little bit about why they're in that setting and how long they've been there, and then the rest of the morning you are going to prepare. You're going to prepare to conduct a full evaluation of your client. I will tell you that we have actual clients coming in. You are not evaluating each other or other students. So part of your evaluation time, you need to be prepared to be able to communicate clearly with your patient. Therapeutic use of self as part of your grading for this, so it's your ability to connect to your client as well. I will tell you that I have posted on Blackboard for you an evaluation form, and it's in a Word format. You can take this form and adapt it to your needs. So it's a very generic evaluation form, and it won't work for every patient. So you'll need to go in and adapt it to your needs. So if you have a patient with a hand injury, it's going to look very different. If it's with a stroke, it might look very different. If it's a mental health disorder, it'll look different. So feel free to take this form that morning and adapt it to your particular client population. So that's available to you already on Blackboard. So at 12:30, that's when the evaluation time will begin. When I give you your case at 9 a.m., it will tell you what time. We're going to be running in hour increments. So starting at 12:30, the first group will go at 1:30, the second group 2:30, and then the last group will go at 3:30. You have only 50 minutes to conduct your evaluation. From the time that you walk into the room, you have 50 minutes. So it starts exactly if your time to go in is at 12:30, it will start at 12:30. At 1:20, you have to be out of the room. If you're not, we will have to ask you to leave. So this is also exercise and time management, which is going to be really important on field work. So manage your time well. Think about before you walk in the room, what are the key things that you need? What information do you need to gather? And make sure you gather that information before you leave the room. So once you're done, you can go home or go somewhere else. You can't stay on campus. And you're going to go then write up your evaluation report. And I already showed you that form that you have by this time adapted to your needs. You're going to be submitting that, your evaluation report. You'll also include 3 functional problem statements at least. You could have more if you'd like. If you can't remember how to write functional problem statements, go back to your documentation book. You're also going to include 3 long-term goals, and under each of those long-term goals, you'll have 2 short-term goals. You're going to briefly describe your intervention strategies, and what I mean by that is you'll just briefly list. You might use e-stim, you might use ultrasound, you might use occupations, neuromuscular re-ed, really quickly, just some brief words. This is going to be important when you do work in physical disability settings, especially because the doctor will sign off on your treatment plan. This is basically quickly what do you plan on doing? Is it teaching them adapt one-handed dressing techniques, things like that. So, and then briefly at the end, what is your reevaluation plan? When do you plan on reevaluating and how? Okay, so that is due the next day on Wednesday at 9 a.m. You will email that to me by 9 a.m. And just like everything else here at West Coast, late assignments will not be accepted. So you can submit it the night before and go to bed at peace that you turned it in, because you need to then, Wednesday, you're going to be working on your own from home or somewhere else. You're going to be working on developing 2 intervention sessions. So you're going to create 2 50-minute treatment sessions. You're going to use the forms provided, and those again are posted on Blackboard for you already. This blank intervention worksheet is what you're going to fill out. At the top, you're going to cut and paste which goals you're addressing during the session. You could be addressing one goal, or you'll be addressing multiple goals. And then you're going to describe your treatment session, including how much time you're using to address each aspect. I gave an example also on Blackboard. I have one here. I've put long-term goal at the top, and then you can see for the first 5 minutes, 0 to 5 minutes, talk to client about goals, purpose of session. So please don't copy my example. This was just an example. And then the next 5 minutes, I do this, 10 to 20. So you're breaking it down. How much time are you spending on each thing? So we're really looking to see, again, for that time management piece, and also that you're pretty realistic. Let's say you have the long-term goal of client will be independent in brushing teeth, that you're not spending 50 minutes having them brush their teeth. That's very unrealistic. Your patient's teeth would be really clean, but I'm pretty sure they would be really frustrated with you that you actually spent 50 minutes having them just brush their teeth. So you're going to fill this out. It needs to be very clear what you're doing. You can see here, provide tactile and physical cues to upper extremity and trunk. Be very specific about what you're doing. What are you doing as the therapist? Right, so trunk and preventing patterning, so you can see. And then I kind of stopped. I just wanted to give you guys a little bit of an example. You are then in the right hand, you see there's 2 columns here. Under types, you are going to circle what intervention types did you use in this session. Make sure it matches. If you're not sure, go back to your practice framework and look at the definitions in the practice framework for the intervention types. Same with approaches. What intervention approaches did you use in this session? Okay, and then at the bottom, you want to list what frames of reference or models of practice did you use, and you might have several. Okay, and then your justification needs to be on a separate sheet. So I gave a little bit here, but really it needs to be on a separate sheet because it should be about half a page long at least. This is where you're going to give a really nice, rich description about why did you choose to do what you did in your session. And this is something that your fieldwork supervisor may ask you. You might have a physician ask you. You might have any other team member or even a patient ask you, why am I doing this? And you need to be able to clearly explain and justify your choices. It needs to be evidence-based. You can see I have a reference in here. So you will have a rich description and then a reference list at the end. So that will be on a separate page. So you are going to do 2 of these worksheets, 2 separate justifications. Okay, so let's go back. And that is due on Thursday at 9 a.m. In addition to those 2 worksheets, you're also creating a 1-page home program for your client. You've done this at least 3 times because this was your part 4 assignment for your older adult, and child and adolescent class. And remember how you had part 1, part 2, part 3, part 4, and part 4 was creating that 1-page handout or home program for your client. Again, you're doing this again. It must be specific for this client that you evaluated and created interventions for. And again, it must be lots of visual information, layman's terms, very clear instructions as to what you want your patient to do at home, or it could be a homework. What do you want them to do when they're not with you? So intervention and home program both due Thursday at 9 a.m. via email to me. Thursday is going to be your last day on campus for that first week. And on Thursday, what you're going to be doing is you're going to be meeting with the physician. We are assuming that your patient has progressed. It has been days or weeks since evaluation and intervention, and now they're ready for discharge. You're going to be meeting with the physician to discuss what progress that they've made over the last few days or weeks. You'll discuss why you feel the patient's ready for discharge, what progress they've made, and why. Really what I want to see is, can you articulate what impact OT has had on this patient? So really you can verbalize the value of occupational therapy. And then you're also going to discuss with the physician what further discharge recommendations you have. Do you suggest they now have outpatient? Do you suggest they do something out in the community? So what are your final discharge? And again, you need to be clear. You recommend discharge or maybe not. Do you recommend equipment? Things like that. So you're going to be meeting with the physician for about 15 minutes. The first 5 minutes are going to be, again, that verbal presentation of the case, progress made, discharge recommendations. And then the last 10 minutes, you're going to be answering questions that the physician is going to ask you. So you need to be able to be ready to answer some clinical reasoning questions. Now, the physician might ask you, why did you choose to do this? Why not this? So just be able to answer those questions. Don't be nervous. The last term when we did this, the students did a fantastic job. This just really does show that you can not only write about OT, but you can also verbally express the value of OT and talk about your patient. So you'll be on campus on Wednesday evening. I'll post the schedule so you know what time you're coming in on Thursday and where you meet. Please dress professionally on that day. So that is your last day on campus that week. On Friday, what's due at 9 a.m. is a discharge SOAP note. If you don't remember how to write a discharge SOAP note, please go to your documentation textbook and look up discharge SOAP notes. And it does need to be written in that SOAP format and be formulated as a discharge SOAP note. So, must match your patient, the setting, and any funding requirements. So, if you have any questions, please feel free to email me, and that's for any of this. Please don't hesitate to ask. I know you will be successful in this, and you'll have a good time with it. I know it's a little stressful thinking about that, but anyway, I look forward to seeing all of you on Monday morning. Take care.